Let's see about the ultrasound assessment of fetal well-being, in which we will be seeing about 4 main things. One will be the fetal breathing movement as seen by the ultrasound. Next will be the amniotic fluid volume. Third is biophysical profile. And the fourth will be modified biophysical profile. First, let us see about the fetal breathing movements. Two types of fetal breathing movements have been seen. One will be gasps, which occur at a frequency of 1 to 4 per minute. The second one is irregular bursts, which occur at a frequency of about 240 per minute. And these fetal breathing movements show diurnal variation and are decreased at night and increased after meals. So, fetal hypoxia leads to decrease of breathing movements. What are the reasons for decreased breathing movements? One is hypoxia and the others include hypoglycemia, sound stimuli, and cigarette smoking also affect the fetal breathing movements. Next will be the amniotic fluid volume. There will be decreased amniotic fluid volume, that is referred to as oligohydramnios, when there is decreased urine output by the fetus, which is in turn seen when there is decreased renal blood flow to the fetus, which is in turn seen due to decreased uteroplacental perfusion. So, initially there will be decreased uteroplacental perfusion leading to decreased fetal renal blood flow, and due to which there is decreased urine output, and thereby there is oligohydramnios. So, amniotic fluid volume measurement is very important, in which we measure the largest single vertical pocket and amniotic fluid index, which is nothing but the sum of the 4 vertical pockets, one in each quadrant. Oligohydramnios is defined as amniotic fluid index of less than 5 centimeters. Next is the biophysical profile, which has 5 components, and those components are fetal heart rate acceleration seen using non-stress test. Next will be fetal breathing, fetal movement, fetal tone, and amniotic fluid volume. These are the 5 components of biophysical profile. A normal score is 2 for each, and abnormal is given 0. So, the total score overall is 10. So, in each component, first in non-stress test, more than 2 accelerations of more than 15 seconds each in 20 to 40 minutes is said to have score 2. And when it is 0 or 1 acceleration in 20 to 40 minutes, it is said to be of score 0. Next, fetal breathing. When there is more than one episode of breathing lasting for more than 30 seconds in 30 minutes, it is given score 2, whereas if there less than 30 seconds of breathing in 30 seconds is given score 0. Next is fetal movement. More than 3 discrete body or limb movements in 30 minutes is given score 2, and less than 2 movements is given score 0. Fetal tone. More than one episode of extension of fetal extremity with return to flexion or opening of closing of hand. So, if there is more than one movement of extension of hand or opening or closing of hand, this is given score 2. If there is no movement or no extension of hand or no flexion, then it is score 0. Amniotic fluid index. When the single vertical pocket is more than 2 cm, it is given score 2, and the largest single vertical pocket, if it is less than 2 cm, then it is given a score 0. This is about the components of biophysical profile and their scores. Next, there is something called as modified biophysical profile. It takes about 30 to 60 minutes for recording the biophysical profile, whereas the modified biophysical profile can be recorded in just 10 minutes. And this modified biophysical profile includes only 2 components, which are non-stress test and amniotic fluid volume, and this is considered to be more reliable and used as the first line in antepartum screening test. So, this is about the ultrasound assessment of fetal well-being, which includes fetal breathing movement, amniotic fluid volume, biophysical profile and modified biophysical profile. Thank you.